The Nigerian government has approved the mass recruitment of young Nigerians across the LGAs to serve as accountability officers who monitor the construction and operation of 8,800 new primary health centers nationwide. The coordinating minister, Professor Ali Pate, said this at a capacity building workshop for state desk officers under the sector-wide approach program office in Abuja. He tasked young Nigerians to monitor and ensure the fiduciary integrity of all health centers they are assigned to for the benefit of local populations. Underscoring the importance of the SWAP framework, the minister noted that the facilitation of interagency collaboration, securing commitments from state governments, and driving initiatives such as the Health Sector Renewal Investment Initiative are critical for Nigeria's progress moving forward.
The SWAP is an approach. So there are expectations around coordinating stakeholders at the state level so that performance management monthly meetings can happen that build up to our quarterly discussions with states. There are expectations around resource convergence, so visibility of spending and ensuring that it aligns with our priorities. There are expectations around AOPs, there are expectations around money, expectations around health fellows. As these programs begin to build up, that interface between SWAP as an approach to bring coherence, coordination, and governance, and the linkage is to ensure that this year we are able to create that thesis that this approach has led to some impact.
It's a consequential year and it's a year of execution. There's a gap between where we are and where we should have been. And how do you fix that when we have 774 local government, 36 states, and a federal government? And to change that direction requires something bold. It requires an intentional effort to defragment the system so that we all row in the same direction towards a North Star. Because if you don't know where you're going, any road will take you there. And having a North Star to say that let's improve population health outcomes. Let's start from the women, the children, because if you cannot, whatever we do, even if you do brain transplant, assuming you are able to do that, but you cannot immunize a child or you cannot save a mother, it's not going to be very impressive. Yeah. So it's a proxy of health system performance if we're able to improve the services, particularly for the poorest and most vulnerable populations. And that idea requires us to act, to think differently, and to have an approach that allows us as federal government, states, local governments, civil society partners to row in the same direction.